Good evening, everyone. It's Wynn Brown here with Haywood Healthcare's COVID-19 update for Tuesday, the 26th of May. In the 80s, fabulous. I feel like kind of I'm a weatherman every night on this as well, saying what a great day it is out there. Hopefully you're outside and have some time with your family, but you're still social distancing appropriately and being careful when you're out in public. And so let's just get right to our testing. We have tested 4,772 with 4,131 negative results, 466 positive, 61 indeterminate, putting our cumulative rate at 10% positive. The state is at 17.3. Let's see, Worcester County's up to 10,505 cases and Franklin just at 314. At Haywood Healthcare, we are at 5 positive inpatients, one of whom's in our ICU, and we have 5 patients under investigation. And so we're come back down into what I would call a bit more manageable level for the disease at this point in time. I've mentioned in several, I guess you'd call them teasers from a staff perspective about entrance control. So on Wednesday, we are going to begin adjusting our entrance control. So staff at either hospital may enter on any entrance that they want to, and they may exit starting on Wednesday as well at any entrance or exit that's convenient to them. All staff must foam in and foam out, and you must wear a mask prior to entering the building. I know some people think it's okay just to pop it on when they're halfway through. No, you must put it on before you go in. You're also everyone is going to get from HR a HealthStream attestation that they need to sign off, that they realize that when they come to work and they punch in, if they are hourly or if they are exempt, that they're coming in and saying that during their working hours, they have no COVID-related symptoms of fever, cough, sore throat, shortness of breath, loss of taste or smell, onset of nasal congestion, runny nose, abdominal pain, diarrhea, or vomiting. And if you have any of those things as you are arriving at work or you are at work, if it's during the normal business hours of first shift, you need to tell your supervisor or manager, and you need to go to employee health. In the off hours when employee health is not open, you need to immediately let your manager know so that they can take proper action and protocol for anybody who is not feeling well. This is our new normal. We used to, in the old days, think we were great coming to work sick. Doesn't work anymore in this post-COVID world. So that will start on Wednesday. Again, you can enter or exit from the usual doorways that you used to use prior to COVID-19, but you're also self-attesting and self-certifying, and I think you'll have till the 10th of June to do that attestation on HealthStream, and everybody knows how to get on HealthStream. We will still only have one entrance at Haywood Hospital for patients, and that will be the main entrance, and we will continue to have entrance screeners there, and we will have sort of a 2-line system. So if you're coming in the main entrance, you can go fast track as long as you self-attest to yourself in your mind and you gel in as you go in and have your mask on, okay? So a large change for us, but again, it's an honor system and making sure that we are all being the professionals that we are and making sure that we're keeping ourselves and our patients safe. Just remember, as we do this, we are also ramping up surgical services. We have greater outpatient volume, more physician visits, a lot of things going on. So that means patient-first parking is in effect. It's always been in effect, but just a reminder that we need to park where employees are supposed to park so that our customers, our patients, can be closest to the doorways for their service. So I appreciate your support of that. Also today, MHU is scheduled to reopen. We had closed that because there really weren't any patients to see at that point in time because contrary to all our popular belief where we thought that behavioral health services would be in high demand, they were not. And so now we see that volume coming back. So we are reopening sometime today. So that is a great thing. Remember, Jerry Psych never closed, and actually its census has remained full or near full throughout the pandemic. There's been some questions about the indeterminate findings from some staff and from some community members, and that really is a situation where the specimen taken for the COVID-19 test wasn't strong enough or was maybe stayed too long in its testing container, and so that they really didn't have a valid result where everything came out either positive or negative, and that's where it is indeterminate. And so We have not had we have had only a couple situations where a patient has come in to be tested, was indeterminate, and was determined to be indeterminate again. So it's really a one-off thing that happens. It has to do with the quality of the specimen that we collect. Also, as we begin to get busier again on the Haywood campus, John Nowak and his team are expanding the hours of the cafeteria from noon to 4. And I know that there's a lot of folks on the floor and also in surgical services who, can't be scheduled to get there right at noon, noon 30, 1 o'clock. And so we're extending our hours there. Dinner is still 5 to 6:30. So those are the big updates today on our campus as we settle into our new normal and volume begins to return. We appreciate the community trusting us. We are doing everything we can to provide the safest place for you to get and receive care as we continue our journey to be one of the best community-owned health systems in America. Enjoy your evening. Thank you.